As some of you know, I have kept a sporadic video diary of back issues, back surgery, back recovery, etc. Just so I can kind of connect with people that might be going through the same thing, that might have some fears or some questions or some doubts about what they're going through. And what's funny is there are so many people that go through exactly what we're all going through, and yet we feel like we're so alone, and we're really not. There's a really large community of people out there that go through exactly what we do. The problem is there are people that have had some bad experiences. There are some people that blow their experience out of proportion because they're super negative. And they kind of like the attention. I mean, there's that everywhere. And then there are people that have great experiences, and the people that have great experiences don't really get heard a lot, and they kind of get knocked down a little bit from those that have bad experiences. So it's a tough community because we're all in pain and miserable, and we're all kind of snarky, so I guess you just kind of got to take it with a grain of salt. As far as I'm concerned, I'm just going to tell you how it is, how my experience is. Is that going to be how your experience is? Maybe. Maybe not. Everyone experiences pain differently. Everyone handles fear and pain differently. So just because, you know, maybe I had a great microdiscectomy last September. If you go back and watch the videos, I had some pain off and on. It was healing pain. I did really well. I was back to work within a couple of months. And actually, not even a couple of months. 1 month, almost literally to the day, I went back to work. In 2 months, I was fully cleared. But then I reherniated end of December of last year, beginning of January this year. Went through courses of non-surgical approach and treatment. Didn't work. Epidurals never work on me. They just don't. Some people have fantastic results from epidurals, so if that's you know what? I'm super jealous, and I wish I would have those kind of results, so I wouldn't have to go through surgeries, but I do. So anyways, I did not keep a video diary the best that I wanted to. Last surgery, I did it every, like, day 1 post-op, week 1 post-op, 2 weeks, 3 weeks, month, couple months, etc. And I just didn't do it this time, and I honestly had planned to. So I don't know that anybody was looking forward to that, but if you were, I apologize if I let you down. So trying to keep this super short because I recorded a video a minute ago and it was like 30 minutes long, so we'll keep it short. Had surgery, had a anterior and posterior lumbar fusion, which means they go in through the front and through the back. I have 1 incision in my belly, which is vertical, starts about 2 inches below my belly button and goes down about 4 inches, 4.5 inches. And then I have 2 incisions on my back, 1 through my old incision from the microdiscectomy last year, and 1 just to the side of that, kind of sideways. Both are about 3 to 3.5 inches in length. So 3 incisions, which is why I always joked, because I knew what was going to happen in the surgery. I always joked that I was going into surgery and they were going to cut me in half and put me back together again. Kind of true, kind of, sort of, not really. Anyways, surgery went really well. Doctor said that I had really strong bones. I have 4 screws holding 2 rods in my vertebrae, which, when I saw the x-rays of it, just looks so funny because I'm like, that's not me. It is. Still have some swelling because I'm about 1 month post-op right now. No, I am 1 month exactly post-op right now. So still have some swelling in the incisions, especially if I've walked too much. I have some back cramping and some back spasms, and my incisions will swell a little. Still have some pain in my belly, which is a little bit stabbing. Sometimes not as bad as what it was. The first 2 weeks, not even gonna lie, was the worst pain stomach-wise for me. Especially being a larger person, I think that makes a big difference because there's a lot of weight tugging and pulling and pushing and resting on that incision. Not saying that, you know, if you're a smaller person it doesn't hurt. I'm sure it hurts equally as bad. It's just a different, I just think it's a different reason for the pain. I think sometimes with larger folk, which I could be wrong, but that's just my experience, so please don't take that as gospel. Anyways, I have some sciatic pain that can sometimes stop me from walking or moving altogether. Have a numb toe on my right foot, not the big toe but the one next to it, and on the same leg, right leg, outside of my calf, have about a 1 inch wide strip that starts about 2 inches below my knee and goes down to just above my ankle. That's just numb. Wasn't like that before. I've never had numbness and tingling before, but I have it now. So we're going to keep an eye on that. I actually just had a course of antibiotics because I had a small infection in the base of the very bottom of the belly incision, which is all clear now, so that's good. Had to watch my temperature very, very closely and pay attention to the gauze pads and everything to make sure it wasn't changing colors or any of that disgusting stuff that I'm not going to go into. Tips. Listen to your doctor. Ask questions at the hospital. Ask questions before you go to the hospital. Practice your getting in and out of bed. Strengthen. I cannot say this enough. Strengthen your arm muscles and your core as much as you can. I'm not saying do crunches and sit-ups because that's not good for you either. Look online for safe core strengthening exercises that you can do that's very low impact and strengthen your thigh muscles. Not even a joke, before surgery. You will have no idea how that will help you getting in and out of bed, up and down out of chairs or up and down off the toilet in the hospital, and then for quite some time after surgery. I was not told that by anyone, and I didn't even think to strengthen all of that before going in. I had a very hard time the first 2 weeks getting in and out of bed and doing all those things, and I was used to the log roll thing from the last surgery, so I have that, but getting up is different this time, especially because of the belly incision. It's just a whole different thing. So do those. I'd say about a week before. Hydrate. One of the biggest things that will help you in the hospital, because they don't let you eat or go home until you are successfully doing all things intestinal. And then one of the biggest things that will help you is hydration. Prep your home. Be prepared to have somebody stay with you at least one night, if not several nights. Take your medication regularly. Don't just like, I'm going to take it before bed and then if I need it I'll take it. No. While you're in the hospital, you're on a regular medication basis. The first week, if not 2 weeks, you're home, keep to that. Even if you think you don't need it, the trick is staying on top of the pain. Always stay on top of the pain. I am, like I said, 1 month post-op. I am not on a regular medication schedule anymore, minus finishing the antibiotic yesterday. I stopped my actual regular like every couple of hours having to put medication in my body. Let's see, today's Tuesday, so it's probably been last Monday. And then I really cut down on the pain medicine and the muscle relaxers on Thursday. So now I take it if I need it during the day. After, I try not to do it before PT or walking because I don't want to trip and fall because the medication is kicked in. So I take it after, or just before I sit down to relax or set on the ice pack. That way, as I'm sitting there, it kicks in and I'm okay. But I now take it just before I go to bed, and then like I said, if I need it during the day. And that's my goal is to. It's July 1st right now. I'm hoping I want to try by the 15th to be at I'd like before then, but no later than the 15th to be at only taking it at bedtime, and then be on Tylenol 8-hour during the day. And that's another thing. Do not take Tylenol while you are taking these other medications, because too much acetaminophen, not good. If you haven't been told to take vitamin D supplements, the vitamin D, calcium plus vitamin D, it's like 600 milligrams, like Caltrate, but you can get store brand, it's the same thing. Take them 1 pill twice a day. If you haven't been told to do that, do it. It's just calcium, and it's really going to help the fusion take. It's really going to help your bones, and it doesn't. There's no side effects to it. Just do it. Drinking milk, you would have to drink gallons of milk every day to equal like one of those pills. Just get the pills. If you go to give a Kroger near you or something like that, there's buy one get one free all the time. Invest. Get a giant bottle of it because you're going to be taking it for a really long time. If you haven't been told to take it, then disregard that comment. Invest in ice packs, whether it be clay ones. If you get clay ones, you only need 2. And they're kind of expensive. If you get just like the regular gel ones, which can be kind of pokey, but be careful, get the larger ones. Get like 4 of them, because you're going to be rotating those out like crazy. Be prepared to not sleep on your back for a while. But sleeping in a recliner the first couple of weeks. Well, the first full week for sure. I'd sleep out here for a little bit and then I'd go lay down in bed, because that was the only way I could do it. Now I'm completely in bed. Still only sleeping on my side. I lay on my back for a little bit, but it's excruciating still to do that. And it was painful before surgery, so I don't want you to think that like, oh my goodness, once I have this surgery, I can't lay on my back. I had that problem before surgery, so I'm not quite, I can lay on it more now than I did before surgery, so that's good. But just be prepared. You're going to have a catheter. You're going to have pain meds. You're going to have ups and downs. You're gonna have these issues, but just be vocal. Do your best to stay on top of the pain. Ask a million questions, and listen to your doctors, your physical therapists that come in, and your occupational therapists that come into your room in the hospital. Pay attention. Follow their rules, whether you want to or not, because you do not want to feel the pain of tweaking your back. I can't even imagine, because I've had moments where I've almost kind of tweaked it a little bit, and it's almost, if I could drop to my knees, I would have dropped. You know, get bathroom aids. Do those things. Don't try to be a hero. Get a toilet wand. I don't care whether you're male or female. Get one. If you don't know how to use it, message me. I'll tell you. It's not hard. Get a handheld shower. Get a shower chair. Get a bar that you can use to steady yourself in the shower. Get a shower mat so you don't slip. Don't be a hero. Don't. Be a patient. Be a good patient. And everything's going to be alright. If you're watching this, you are either in pain and about to have this surgery, or you had the surgery and you're going through it and want to see if you're alone. You're not alone. Find somebody you can be surgery buddies with. I'll be your surgery buddy. I don't care. We'll walk through it together. Everything's going to be okay. You're going to feel better. And if you have to, find another doctor. If that's the problem. But everything's going to be okay. I'll try to update again in a couple weeks. Until then, feel free to leave comments, ask questions. I'll do my best to stay on top of it. Have a good day, and I hope you're pain-free very, very soon. Bye.